Thank you, Lillian. It's a pleasure to be on this panel and to discuss the issue of gender-based violence. I introduce myself. I work for the International Rescue Committee, and we work in communities that have been impacted by different crises. And so I'll be sharing more around the issue of gender-based violence, but also focusing on what happens during a crisis. Just from the basics, I'm not assuming that anybody doesn't know what is gender-based violence, but just to get us on the same page, I'll be using there are so many definitions of gender-based violence. In particular, I'll be using the definition from the Interagency Standing Committee, the ISC, that defines gender-based violence, or GBV, like I'll find myself referring to during this presentation. It's a general term used to describe any form of harmful acts that are committed against a person's will based on how the society defines and differentiates the roles and the responsibilities of women and men, girls and boys in any society, and knowing that I'm using this as the traditional understanding of gender and of men and women, girls and boys. So I'm using that consciously today, but knowing that we can have another discussion about whether this is the only definition of gender. But this means that it's about how women are viewed and how boys and girls are viewed in the society, and the power and the position that they are given generally in the society. This includes different acts that could bring physical, sexual, or mental harm or suffering, or even threats of such acts, coercion, and also deprivation of someone's freedom. And this act could be happening either in the public or in the private sphere. Today, the topic is phrased around how this is happening in the private sphere, which is the homes. I also I'll be focusing more on violence against women and girls, and I want to first ask why violence against women and girls. Different panelists will be focusing on different aspects of GBV. And to know why I will be talking about violence against women and girls, first of all, is to understand this violence from a gendered angle, because this will become critical in understanding why violence against women and girls. The gender dimension that comes into play against women is different from that comes to play when we are talking about men and boys. Understandably, men are also exposed to different forms of violence because of their socially determined roles and norms. But the violence for men is not, whether mostly perpetrated by fellow men, rarely, if ever, contributes to confirm the overall position of men as an entire subgroup in a society. And it could be because of other aspects, like, for example, age. You'll find that young boys are likely to be facing violence than older men and all that. It could also be because of other aspects like political, where we find cases of sexual violence where communities are reventing against each other when there's a crisis. So for this presentation, I'll be situating it from a perspective of violence against women and girls and how this increases during a crisis like the one we are having now. There are different forms of violence, and the people will classify them differently. So I'll choose this particular classification where we classified, it could be sexual violence, and there are different forms of sexual violence. In Kenya, the legal term, for example, for sexual violence against somebody under 18 is defilement, but that's a legal definition. So all of it is sexual violence and can take different forms, including sexual violence where people are being exploited for access to basic things. Like, for example, when somebody is asked for sex so that they can get food, there's no consent there, because the issue of food as a basic need means then that this person is being exploited for the basics that they need. And this happens a lot, especially when we have a humanitarian crisis. There's also sexual assault, physical violence, which can in different forms, including beating and other forms that inflict physical harm. Emotional and psychological violence, including abuse and confinement. And we have persons specialized in psychology today, and we'll be hearing more from them possibly on that. There's also harmful traditional practices. So these depend on different communities, but the more common one include forced marriage and also marriage of small girls who are not yet 18. And I'm taking 18 knowing that there are some countries where the age of consent is below 18, but I'm taking 18 because that's the globally accepted age as far as defining a child is concerned. There are also socioeconomic kinds of violence and denial of opportunities and social exclusion. So those are just in summary, how we can define different forms of violence and classifying them. So I'll be focusing then on GBV during crisis. So gender-based violence happens in the community regardless of many other factors like economic, whether there's a crisis or not. And the globally accepted statistic is that 1 in 3 women and girls experience physical or sexual violence in their lifetime. And there's a higher percentage of violence that is happening from their partners, their husbands. So the intimate partner violence is quite high. We know that gender-based violence is happening all over the world, and more often it is underreported due to different factors, including stigma of retaliation, limited availability of ways to report, or limited accessibility to places where people can report, and so many other factors, including the fear of impunity, where the perpetrators may really go scot-free, so there's no much deterrence, or even lack of awareness of the benefits of seeking care, where people just choose to not report because they don't think it's something that they need to go and seek care for, or they think seeking care sometimes also can add more trauma in some situations, so they may not. And so this happens normally, like in situations where we would say we are living in normal conditions, but then the situation is made worse during a crisis, and this is crisis of any kind. It could be health crisis like we're experiencing now, it could be flooding, it could be conflicts and war. So we see that it really accelerates when there is a crisis. That is what we are calling the shadow pandemic. Much as we have the pandemic, the COVID-19 that we are all dealing with, we also know that there's multiple studies that have found that emotional, stressful conditions usually contribute to increased aggression. And with increased aggression, then we have increased violence, especially violent behaviors, and a lot of it happening in the homes. We are all aware, and mostly we've heard, especially when there's a conflict, that there's a lot of sexual violence that is experienced, but also like from recent researches we've done with IRC and also with other organizations, we know that intimate partner violence, even in conflict, rises to high levels. And so since COVID-19, which is the crisis that you're talking about today, there has been a global outcry around the world where there's been a buzz about the concern of violence increasing, especially domestic violence, that has either been reported in high numbers, or in some situations there has been very much of a decline in reporting, which is also a concern because it means that people are not accessing the services. So this has been a major concern. And around the world also, different researches have shown that epidemics and conflict have already been amplifying the situation and makes it even worse, especially for persons who are in the house, and in particular for women and girls, and also boys in the homes and in the communities. I also want to note, like when we were starting, and I like what was said, that sometimes we don't need to wait for data. So one of the critical approaches as far as handling GBV is concerned is that we should not wait for data. We should know that gender-based violence is happening, whether there is statistics to prove it or not. Many times we get a lot of voice and us discussing it more when there has been an outcry. But immediately a crisis happens, we should assume violence is happening. Secondly, there is safety and ethical challenges when collecting data as far as GBV is concerned. So one of the critical things is for us to know violence is happening, whether there is data to support this or not. I want to also share some lessons that we've learned from other countries that have had epidemics, where it clearly shows that any outbreak of an epidemic or a pandemic like we have this time is also an attack of another, there's also an attack of another pandemic, which is violence. And this is often underreported, and that's why we are calling it the shadow pandemic. For example, in the 2014-2016 West Africa Ebola response, women and girls were highly affected and infected by the Ebola. But also there was an increase in sexual and domestic violence, and there were very high rates that led to long-term implications. So while public health workers were tallying the numbers for Ebola-infected patients, many girls who are victims of gender-based violence were not counted. In Liberia, Guinea, and Sierra Leone, we saw there was a surge of teenage pregnancy for up to 65%, which is really, really worrying. And this is likely that it was caused by the incidences of rape that had increased during the pandemic. So this is the situation we are finding ourselves in Kenya, that of late we've had quite a bit of an outcry around the issue of teenage pregnancies, which leads us to a very sad conclusion that home is not always the safe haven. We have what we loosely call lockdowns in Kenya, people being in their homes more. And unfortunately, there's evidence that home is not always the safe space. There's a quote that was said recently by the UN General Secretary, Antonio Guterres, that women and girls' major threat looms largest where they should be safest, that is in their homes. So this is one of the saddest things, and I'm glad that today we are discussing this. So there is then a necessity to make sure that we are addressing gender-based violence. A prediction by UNFPA based on different data is that there is a possibility of a 20% increase, especially on domestic violence. And I'm so referring to domestic violence as the intimate partner violence happening in the homes. So there have been different measures that are necessary because of curbing the pandemic. And one of them is that then people are finding themselves in lockdown and social distancing and spending more time in the home space. And so for that, then we find that many of them are getting abused. Some children are left at home without their usual caretakers because normally school will be mostly the safer place for them, but then they are in the homes and possibly parents may need to go and work, so they may not be having the regular caretakers. Also, some children have gone to the village where, because of the fears of virus, so people took their children to the village for care. Sometimes in the village, we are working more with older persons who may have less ability to take care of these children. Also, children may have limited information, or that like they would access some information in school, which they may have limited information access now when they're in the homes, or they may have uncontrolled access and exposure to information that would be harmful. So that leads to some of the complexities that we have as far as violence in the home is concerned. So I'll summarize just a few of the complexities that then we have as far as the violence in the home is concerned. Like I said before, yes, there's a rise in social distress among all of us, and so there's a possibility of increase in GBV. Then some of the social spaces that helped are no longer available. For example, children would be in school and that would be a safe space for them. Women and girls would have social networks for support. So those kind of spaces may no longer be available for many people, because then we also don't want to be interacting because of the fear of contracting the virus. It also means then that survivors are often trapped in the same environment as the abuser. Hence, it is risky for them, and it's risky for them trying to go and report. The other thing is that abusers are mostly persons well known to the victims, and they are often living with the victim. In addition, there's a limitation to the avenues that people can report. So it could be that people may not be aware where to report, but also reduction in services because of the lockdowns, or reduction in the areas that the mobility, how much you can travel outside your locality. This could also lead to more risks in that then it becomes so difficult for people to seek help. For the issue of children, they have no way of calling help. They don't have a phone, they don't have a network. Basically, they are stuck in the home, possibly with their abusers, and they have no way of seeking support. If guardians and parents are not seeking support on behalf of the children, then the children are really left without an alternative. Another fact is the increased care and burden for women and girls in the households because of the traditional gender roles that we have, for example, even in our Kenyan society. So then there is that increased care of burden, even including caring for sick relatives or spouses. In addition, with the schools being closed and with the increase in percentage of girls who are reporting to have been abused and having teenage pregnancy, it means then that there is a possibility of a higher population of girls not reporting back to school when the schools finally reopen. So it means some girls are also losing a chance in education. And finally, there are some children who relied on school for some basics, like for example, sanitary pads or for some food. So it means then also this kind of support is no longer available. So what can we do as a society, as a government? We are already seeing some of the actions we are taking, including having this webinar and having many of us coming to discuss about what we can do. So government definitely can help protect women and children during violence, including having services that are available for women and girls, for everybody who experiences violence to know where to report. So we have, the government has a big responsibility as far as that is concerned, including hotlines, shelters, and other specialized services. That is something that would be very critical and is critical. And I believe that there's still much, much more that can be done. It's therefore the role also of the government to punish perpetrators. And that means that the law working as a society, one of the things we find is that there's usually quite some justification around violence. There's justification and even blame. Like, for example, hearing a lot of blame of girls are misbehaving, and that's why there's high violence. And that even fails even to recognize the basic that when you're talking about a girl misbehaving and the perpetrator is an adult, and not placing the blame on the perpetrators. So that is one thing we can also do as a society. We have to stop justifying violence. Much as we know these, what we're talking about are contributing factors. But the root causes is the cultural acceptance and the behaviors of the individuals carrying out the violence. So much as we know there are factors that are contributing to this, it does not mean that we start justifying the violence, that because there's a lot of stress, it's like sort of acceptable that violence is going to happen. So we need to stop justifying that. The society then response become very critical. We all have responsibilities and roles that we can play, both in our private sphere, but also as members of the society. While I agree that parents have a very critical role, and also guardians, we also need to look beyond parenting skills to the lot that we have in the society. It's most of the times, yes, some of the parents are perpetrators, and so it means that we also need to address this. We can talk about protecting the family, but if protecting this family is actually having persons who are suffering in the family living with perpetrators and going on experiencing violence, because then we are hiding and we are ensuring that this does not get out. And that's why when I was introducing, I talked about violence happening in the private and in the public sphere. And many times the violence happening in the private sphere, sometimes we hide it in the process of protecting the family. But if you're protecting a unit where the individuals in that unit are suffering, then we have to ask our questions whether that is protection. Definitely, that is not protection. So we need to be able to handle that and to be able to challenge and take actions even in the families. I'm happy to know that at least, for example, we have Makueni County where there's a government-run safe house that has been established, and there's much more that we need to do. Having people living with their perpetrators, having children in homes where they are facing violence and they're not able to get help, and we are still protecting that unit, then that is really a challenge, and it's a challenge that we need to take as a society. So before I conclude, so what can we do? Violence happens across. And when we talked about even the general statistics before a crisis, even the 1 to 3, it means that even as we are sitting here and discussing this, a good number could be experiencing violence. And it does not matter the socio-economic and other status, many people will experience violence. So what can we do? One critical thing is safety planning. Planning for the safety for yourself, planning for the safety of your children, if you feel that you may be under threat of violence. And this also means planning how you could be able to access help. Like I said, the fact that people are living in the homes, and many times it's difficult for somebody even maybe to make a call because the person who is perpetrating the violence is also in the same home. It means people need to really plan as to how you can be able to ask for help. I know there are some countries where they had different ways of communicating, where maybe a woman will call a pharmacy and she won't speak, and the person on the other end will know that this person wants to report violence. So if we can also get measures, possibly within different communities, in a way that somebody can be able to ask for help, and also then being able to plan and get ready, having the essential persons that, the essentials that you would take with if you needed to escape from the violence. Sorry. Secondly, if you're experiencing violence, please reach out to family, reach out to neighbors, and also be the person who can be reached out to. I've written the hotline, 1195, and you could test whether that's working. Calling for help, also seeking out local services for survivors. So all of us have a responsibility of seeking where people can get services. A friend may actually disclose to you, and they may not be having the courage to actually seek out those services. So even seeking for contacts and referrals as to where we can refer survivors, that will become very critical, and it's part of our responsibilities. Health systems can really help women who are suffering during this COVID-19. Many times when there's such a crisis that we are having, the immediate reaction is to really seek for the immediate response to the crisis itself. But like we are seeing, we are having the shadow pandemic. So health systems, which is one place that people may find a bit safer and easier to go. So this is also one place that can really contribute a lot in terms of helping survivors to access services during this time. Establishing the referral pathways that we can have even within our communities. A referral pathway is where somebody knows that if I seek help, this is where I can go. And once I go to this spot, the person in that spot can refer me to a different place to get services, because people need different services, mental, psychological, some of them it's really deep psychological, some of it is basic case management, others need even economic kind of assistance and different kind of assistance that people need. So being able to find out how we can establish those health systems. Lastly, all of us realizing that we all have a role to play in preventing gender-based violence, but also that if you suffer from gender-based violence, it's not your fault, and it's always good to seek for help. Thank you.